from the vendor might not be relevant to each clinic. So we tend to make our own courses where we have one or two medical physicists who try to solve a clinical problem in collaboration with the vendors, and then they make a teaching course for the rest of the staff in the clinic.
Okay. Can you identify key capabilities or competencies that your staff at advanced practice level should possess or should develop in each domain of advanced practice, in each pillar? For example, for the clinical practice, what do you think it's important?
It's extremely important that they are able to make their own decisions for the patients. So it's important that they can see a certain clinical problem from different perspectives and thereby select perhaps not always the correct solution or the best solution, but always a good solution for the patient. Because a new eyes on a problem also often gives new proposals for solution. But they have to be good enough to make a good solution for each and every patient. And it takes quite a few years for a new staff to develop the skill set. You have to see a lot of patients to be able to make a good decision for the patient in front of you.
Yes, good clinical and professional judgment. Regarding research, what do you consider they should develop and should have as a competency specific in radiotherapy or a capability in terms of healthcare practitioner?
Research is difficult. In Denmark, we do not have a long tradition for radiographers doing research. So it's quite difficult to have the radiographers do research projects on their own. Often they are more like clinical assistants for a medical doctor or a medical physicist on their research projects. Okay. And we have no good master education that would help us here yet. But that's what we need, I think.
Yes, because the radiographer is more a collaborated assistant to collect data, but since you have autonomy in the practice development, yes, it is a good chance for but without education, without support, it's a challenge.
It's very difficult.
Yeah, that's very linked to education.
Yeah.
And talking about education, what do you think about the domain of education? Besides the staff needs to perform their own role development through the years, they also need to educate others. In terms of colleagues and also interprofessional. This occurs in your department? They educate, for example, a trainee medical physicist or a trainee medical doctor in a specific subject?
Yeah, and I really think that most of them do this extremely well, and it gives them also a development in their own profession to help educate other staff members, because they are forced to reflect upon their own practice when they teach others what we do and how to solve a problem. And that is also what I hear from my staff when they have a new role and they should educate students or new staff. Then they return half a year later and says, well, this was actually really good for me because now I have all these reflections on my own daily practice. I have all these reflections on the relevant theory that we use for this. So I have learned a lot teaching others. So that's a very good job function to have.
And regarding leadership and management, what do you consider important?
Yeah. We have a program in the region that I work where we tend to try to spot future leaders, and we have a program to develop them or to help them decide if leadership is the way to go for them. So we have a number of courses that have the goal to teach them about leadership and to give them reflections of if leadership is the way to go for them. And we do not develop leaders just for our own department. It is a program that serves a common need for all of the institutions in the region that we work in. So, for instance, I just had a radiographer on a 3-week course for a pre-leadership course, but I have no position for a new leader in the department. But the skills that she acquires may be used in another department on the hospital or on another hospital.
Yes. Sometimes there not exist the management posts or mid-level, for example,
no.
But leadership, we can see leadership in one shift is responsible, accountable for that unit, for that machine, or for that group of patients, and you can lead the work, the process. I was wondering, in your department, do you have responsibles by units? How do you have how can I say, that kind of roles?
Yeah, we do, but they do not have to be on that unit every day. They can be a person that you can ask if you have a question or you need help with a specific task.
Okay. According to our study, 52% consider that they have educational gaps at national level for advanced practice. So you already mentioned that does not exist masters to support research and to support more advanced practice in the profession. So do you agree with these findings?
Yeah, I do agree, but on the other hand, I don't know if we could solve it with a master education. A master education takes 1 to 2 years, depending on the level of time that the student has to invest in it, and we have economical issues that prohibits us as employers to fund a lot of people that would like to do a master's degree.
Okay. And
so if it was possible, they had to pay at least some of it themselves.
Okay. Do you have other roles besides your work as a manager in terms of the profession, representativity?
Yeah, I also have a strictly clinical role where I also take